The following video was developed by Futures Without Violence. This video was produced by the Reproductive Health National Training Center, RHNTC, navigating reproductive coercion with a client in a reproductive health setting. Reproductive coercion occurs when a person manipulates or attempts to control another person's reproductive health. This includes things like attempts to impregnate a partner against their wishes, interfering with contraception, or coercing a partner to have unprotected sex. Abusive partners may sometimes monitor menstrual cycles specifically to watch for missed periods. When a provider identifies that reproductive coercion may be taking place, they can offer harm reduction techniques that mitigate the effects of coercive practices. Notice what occurs in the following scenario.
So the test is negative, which means that you're not pregnant.
Thank God.
Okay, seems like you're feeling relieved. I know you said you wanted to talk about birth control. Does anyone know that you came in today for a pregnancy test?
I have a boyfriend, and we've been going out for like 4 months now, but I didn't tell him about it.
Okay, I hear that. Are you worried what will happen if you bring it up?
I like him a lot, but I'm like not sure what's what. Like he keeps saying he's going to use a condom, but it seems like something always happens. Like it breaks, or he doesn't use them.
Okay. One thing I want to make sure you're aware of is emergency contraception pills, sometimes called the morning after pill. It can be used at any time if the condom breaks or if he doesn't use one. Some folks take them out the packaging so that people don't know that the pills are meant to prevent pregnancy. But they are not as effective as using birth control methods consistently. Do you think he would support you using birth control?
Well, here's the thing. He really, really likes me. And he talks about the future. He thinks that birth control can mess people up, so you can't get pregnant when you want to. My grandma, she talks about that too.
It's fair that your grandma is worried about you. There is a long and unfortunate history in the medical system and with healthcare professionals controlling people's reproductive choices, especially those in Black and Indigenous people. There really were cases where some people were left sterilized or left unable to have babies without their knowing it, which was a terrible injustice. And I totally get why your grandma's looking out for you.
Right. I love my grandma.
Now, on the boyfriend front, I want to talk to you about something that we see happen and see if it's something that you're possibly worried about. Sometimes we see partners try to get you pregnant to keep you with them, or so that people know that you're theirs, even if that's not the case. And I know you talked about the condom breaking or sometimes not being used. Could this be why this is happening?
Maybe. I guess that's part of the reason why I didn't tell him that I was coming to see you today.
Thank you for sharing that with me. I know it must be anxiety producing. Are you worried about anything else with him? Him possibly getting mad or threatening you with social media, anything like that?
No, he's sweet. There isn't anything like that. I just don't want him in my business. I want the birth control, but he does not have to know about that.
Okay, I hear that. There are methods of birth control that he doesn't need to know about. Would it be helpful to hear about those?
Yeah, it would be helpful to hear about those. I really, really don't want to get pregnant. Like, he keeps saying he's worried about me getting all messed up inside. Like, I think he would know and be upset if I didn't get my period because of the birth control.
Okay. There are methods of birth control that can be kept private and methods that do not disrupt your cycle. For many women, it's important that they get their period every month. Would it be helpful to hear about those?
Yes, I would like to hear about those. I think it would take some of the pressure off me. You know?
Yeah, got it. Besides that, is there anything else that's important to you in a birth control method?
Learn more at rhntc.org. Developed by RHNTC, the Reproductive Health National Training Center and Futures Without Violence.